Welcome, Dr. Giddy.
Thank you, ma'am.
So she is director and fertility expert at Umang Hospital, Bilaspur, and secretary of Foxy Bilaspur Society. Welcome, Dr. Gitika.
Thank you, ma'am. So I think I'll proceed with the session. And I would like the attention of all the members sitting in the hall, as well as from the young girls from the IT department, because laser hair reduction is something which is very important for all of us. So, midlife hirsutism. If I talk about midlife, I think we are talking about the age group of around 40 to 60 years. And all of us, most of us fall in that age group. And hirsutism, as we all know, is the growth of excessive dark, coarse hairs in male pattern distribution, possibly in the face, chin, upper chest, lower chest, body, thigh, arms, and these areas. So now, what are the four types of androgens? We all ladies, we are women, but we also have androgens in us. So the four androgens present in our body, as we all know, is DHEAS, DHEA, androstenedione, and testosterone. But can any one of us tell me that which is the most potent of these? So the most potent androgen in our body is testosterone. That is the one which is causing harm in most of us. And what are the sources of these four androgens? So there are only three sources of androgens in our body. One is our ovaries, because we are women. Second is adrenal glands. And if we go to the third source, it is adipose tissue. So anything which has to create some problem has to affect any of these three things. So let us see how these common causes of hirsutism is affecting these three organs. So there's this lady, I think I'll go with the case scenario because time is short. There is this 30, maybe for 38-year-old lady who comes to our OPD, and she says that I was kind of facing problems since my menarche. My periods were irregular. I always had problems of abnormal hair growth in my body, and it has continued to exist. So these are the cases where we are suspecting the mild causes. And the mild causes could be because now she is extending towards her perimenopausal age group, the estrogen has gone down, but the androgen level remains the same. So it is a relative state of hyperandrogenism. The second could be some idiopathic factors, no reason at all. The third could be familial reasons, maybe some history in the family. The fourth most common reason, which is the only thing we suspect when a patient comes to us, is polycystic ovarian syndrome. She continued to be so, and now maybe an extended version of PCOS, which is hair and syndrome, hyperandrogenism, insulin resistance, and acanthosis nigricans. These are the simple ones. I'm not talking about them. But as I feel no shame in saying that 10 days before now, when I got this topic, I feel I was so undereducated regarding this topic. If there is this lady, now she comes, she's a 42-year-old lady, and now she comes to my OPD. I feel that she's obese. She says, I was all fine 6 months back, but suddenly something has happened to me. My periods have drastically gone erratic, and I am having hairs all over my body, very coarse hairs. And then I see her, and she says, I'm finding these four symptoms in me again: temporal baldness, I go down, deepening of voice. I see my breast, they have started to undergo atrophy. And downside, I am feeling that I am also having clitoromagaly, which is a clitoral length of more than 1 centimeter. Then these are the cases which we gynecologists should never miss. And these are the cases of severe hirsutism. Possible causes, how androgen increased so much in a short time span. Possible reasons: an adrenal tumor, an androgen secreting tumor of the ovary, Cushing syndrome, possibly because of some adrenal reason or some medical reason, and an extended form of PCOS, which is the hair and syndrome, which I already mentioned. So this is the part which we always miss in our OPD. Now, the scoring is simple. It is given by a person named Ferriman Galway. And if the score is, I think I will go ahead, if the score is more than 25, this is the red flag patient, which we all gynecologists should never miss. They are the cases of severe hirsutism. Now, the mild and the severe version I've already discussed in my case scenario. So, the red flag again, the downside I've written: testosterone level more than 150 nanograms per deciliter, a rapid onset, less than 6 months of history, with signs of viralization, the four signs which I mentioned, and possibly a short duration of history, and a DHEA level also more than 700 nanograms per deciliter. These are the cases which need an urgent workup, and we just as gynecologists cannot afford to miss on such cases. Now, the lab workup history we have taken. Lab, I would say they've mentioned so many tests, but I think the four tests which are very important in such cases, we just do a testosterone level, that would do, prolactin level, a fasting glucose and insulin for polycystic ovarian, this thing, and a thyroid status. So these are the four things which would help. And if we are suspecting the severe cases, we'll have to undergo a ultrasound abdomen or a MRI scan to rule out malignancy. Now, treatment is very simple. Weight loss. Most of these patients would have undergone waxing or some hair reduction methodology. Laser hair reduction, which is the second part of my topic, is something which is very popular and it has become a billion-dollar industry. The hormonal therapy has to be concomitantly given along with the lifestyle modification. And the first line of choice in such cases is oral contraceptive pill because it reduces the LH level and thereby the androgen level. The rest of the treatments, spironolactone or flutamide or finasteride, these are the drugs which are anti-androgenic. They're mostly limited to the transgender community because they are the ones, if they've gone from a male to a female conversion, so they are the ones which actually need this intense anti-androgenic treatment, possibly lifelong. And the surgical possibility, if there is a severe case or any tumor, we can go ahead with the surgical part. Laser hair reduction, I think we are falling short of time, so I'll just go to the important things. Principle, we all know that there's an energy source which is going to go inside the skin and it is going to damage our hair follicle. Now, these are the five types of lasers: ruby, alexandrite, diode, Nd:YAG, and IPL. But the slide which I would want you to know for yourself is India. India is one of the countries which has the best result in laser hair reduction. Why so? Because we are dark skinned people, not very white. Anything, the chromophore for laser is melanin. Melanin is present in the skin as well. So whenever we are putting a laser beam, if we have melanin, it will also disturb the epidermal melanin as well as it will destroy the melanosomes of the hair follicle. But because we are not very dark and we are not very fair, so the chances of side injury is less and the focus on the hair follicle and hair reduction is the best. So actually we fall in this grading. We are olive skin people or maybe brown, and we have the best results possibly with the Nd:YAG and diode laser. I do have a laser machine in my clinic. We mostly use diode for laser hair reduction and Nd:YAG for some difficult cases. If they're actually very dark complexion, then we go ahead with Nd:YAG to provide the peripheral injury. And pre-treatment, I think simply if I would want to say, because again the time is gone, we are exceeding our limit, just tell them one thing. For 1.5 to 2 months, please don't do any shaving or don't go to a beauty parlor for any hair reduction or anything. Come to us 24 hours prior to the treatment. Just do a waxing, not a waxing, a shaving and come, so that the shaft of the hair gets broken down and the bulb remains, and then we do the procedure. And post procedure for first week, you have to apply a SPF 50 sun protective cream, ice packing to get rid of all the side effects, and maybe a low dose of steroid which would weaken down the reactions. So this is the pre and the post of laser treatments. And please tell every one of them who come with unrealistic expectations, they'll have to take 6 to 8 sessions because anagen phase hairs are only 15 to 20% at any point of time, and this laser is only going to reduce the anagen phase hair. So they'll have to repeatedly come for 6 to 8 times so that we cover around 70 to 90% of hair. Still, they'll be left with some 10, 15, 20% hair in their body. Again, they cannot sit back at home after taking treatments. Ask them to come back to us again for a maintenance therapy at least once or twice in a year. That is required. So the unrealistic expectations which the patient keep with us actually we can get rid of them. And of course, the litigation part of it. Thank you so much all for the patient hearing. And yes, ma'am. Any questions, ma'am? Thank you, ma'am. Thank you so much.